everyone. Let me welcome all my viewers once again today on Beyond Sugar. It's always a pleasure to connect with all of you for these live programs. And as you are aware, Beyond Sugar is created for all of you in scientific collaboration with RSSDI, which is the apex body of diabetologists in our country, and also Indian Society of Nephrology. Through this mode, not only we share with you content on a daily basis to make you aware about diabetes and how to manage its complications, but also for you, we invite leading doctors from across the country who can talk to you directly as a friend and answer the queries also you have. I'm very happy and glad to welcome Dr. Parag Shah from the city of Ahmedabad today. So, welcome to the program.
Yeah, welcome. Thanks for inviting.
Yeah, it's pleasure to be having you, sir. A lot of our viewers, they keep us sending us questions, and through which we pick up the important topics for discussion. Today, we will be using your expertise to talk about a very, very important topic, which is diabetes in children and how do we manage that kind of a situation, not only medically but across the spectrum. But before I start taking the questions from our viewers, let me give a formal introduction of Dr. Parag Shah. He's one of the senior most endocrinologists from our country. And he has done his DM in endocrinology from SGPGI Lucknow in 1997. And since then, for last 27 years, he's been serving his patients. Not only he has treated lakhs of patients, but also he's been publishing many research papers in medical journals. He is routinely invited to medical conferences to educate his fellow physicians, and is also actively doing a lot of patient education programs as well. Currently, he is director at Gujarat Endocrine Center in Ahmedabad. So let me now straight away give it to you and help us understand that how common is this situation having diabetes in children, and how is this like sort of different as compared to diabetes in adult population.
I think this is a very important program, and specifically, this topic is very good actually because most of the talks and the discussions among the physicians as well as the patient education programs are centered around diabetes with the adults or type 2 diabetes. Unfortunately, type 1 diabetes, though is not that common as a type 2 diabetes, but it is not just a medically difficult to manage, but for the family and the society, psychologically, financially, and emotionally, it's quite disturbing. So there are many myths, many fears, many misconceptions about diabetes in children. I think we'll try to answer one by one all the important aspects which community, parents, and the children should know about the diabetes among the children.
Yeah, so thank you very much, sir, for actually acknowledging this fact that this is such a sensitive and important thing, even though numbers of such patients would be less, but it is so very important to handle them with a lot of sensitivity and care. So first question is about a curiosity one only. Largely, we have seen diabetes happening it was considered to be a grandfather's disease, and then we saw a lot of people in their 30s and 40s also picking up diabetes. But as you mentioned that it happens in children also, even though the number is less. But what is the reason and how is this different, and why do children at such a small age will have diabetes?
See, if you consider children below 18 years of age, which includes lots of teenager children also. So, if we are considering diabetes among the children, the traditional teaching when we were doing our endocrinology training around 3 decades or so ago, it was always considered that it's a type 1 diabetes. So basically, we got a predominantly, except pregnancy and some other reasons, we got a type 1 as well as type 2 diabetes. So type 1 diabetes are the disease where there is a autoimmune process in the body which is triggered unknowingly by some unknown reasons or because of some infections. The antibody triggers after COVID era. I think we all know antibodies very well. We get the vaccine and we use to measure the COVID antibodies, which gives us a protection. But autoimmune diseases are the disease where body's immune system produces the antibody which in case of the protecting the body, it actually starts the destroying certain organs. So if the beta cells are the cells in the pancreas which produces the insulin, and this antibodies tries to destroy these beta cells. The beta cell secretion capacity of the insulin gradually goes down. So that is how actually they have got a very little or almost negligible insulin secretion in their body or in their pancreas. So that is a type 1 diabetes, which can occur at any age actually. It can occur at 40, 50, 60 years of age also. But if you take all type 1 diabetes, which are autoimmune in nature, 97 to 98% are among the children. Now, last decade or so, we are seeing lots of children who are become obese with a insulin resistance, where body produces insulin, but insulin is not working efficiently, leading to increase into the blood sugar, what we call the type 2 diabetic, where majority of the adults, which we commonly see in our surroundings, are having a type 2 diabetes. But we are seeing a good number of type 2 diabetic among children also, but we should not miss out on a very important aspect of the diabetes in a children, that is a type 1 diabetes, where there is a significant reduction into the insulin secretory capacity. And most of the time it is not because of the identifiable cause. There are causes which is from inside, which is not a modifiable cause, or you can't do about it. And most of the time it is not running into the genes. So that is not a family history of a type 1 diabetic among the families most of the times. Many of the siblings also don't have the type 1 diabetes. So it is a more commonly non familial type of the diabetes occurring at any age, but more commonly below the age of 18. But some of the kids with diabetes might have type 2 diabetes also.
Okay. So, in nutshell, correct me if I'm wrong. So you're saying that in children, it's mostly type one diabetes, but it can be type two also in certain cases where they gain weight and due to other reasons. But largely, it is type one. And in type one, it's an autoimmune sort of a problem because of which the insulin secretion cells they are destroyed and someone will get diabetes. All right, so I think for our viewers in the simple language, Dr. Parag has helped us understand this. So now the second question is, how do we identify this in children? What are the symptoms? Because you are not suspecting diabetes to be happening in children, and then therefore you may miss out. The parents can miss out. So are there any common symptoms? And then especially even at for those children who are very young, who cannot even speak properly and show that or tell to their parents what they are going through. So can you help us understand how to identify that?
Yeah, we'll talk predominantly for type 1 diabetes in children and their symptoms, how to diagnose or how to have some suspicion among the doctors as well as among the parents or the caretakers. So most of the time it is acute in onset, but it occurs all of a sudden. It does not remain hidden for months together or years together, unlike type 2 diabetes. So most of the time there is a sudden decrease into insulin secretion, leading to more increase into the urine frequency. The child who was not going to pass urine at night, night time usually is noticeable, that you always remember whether we are getting up for the urination at night or not. Daytime, if I ask somebody how many times you go, even I would not remember how many times in a day I go for urination. But nighttime is something which is noticeable. So any increased frequency of urination, specifically at nighttime, increased thirst, unexplained weight loss, feeling tired, more fatigability. Usually, the children are very playful and very energetic. Most of the children are so energetic, their parents are tired of their activeness. They feel that ये सो जाए तो अच्छा है. They are so energetic, and suddenly the child becomes less energetic, feeling weak, feeling tired, gets lots of infections. Or if this is not diagnosed, they can start developing acetone in their blood, which translates into the symptoms of loss of appetite, nausea, vomiting, and even then, if it is not diagnosed, can it lead to breathlessness and very occasionally unconsciousness or a convulsions. So anybody who has a unexplained sudden increase into the urine frequency, increased thirst, unexplained weight loss, unexplained tiredness or a weakness, the parents should suspect that child also can have a diabetes. And now it's very easy to diagnose diabetes by either, if your family member has a diabetes and you have glucometer, you can just first check with the glucometer, go to a pediatrician, go to a lab and check for the sugar. And if the sugar is high, then naturally we'll ask for the serum acetone to make sure that how severe is the diabetes at the time of the presentation, whether child needs admission and requires IV fluids and IV insulins, or if there is some concurrent infection like pneumonia or some respiratory tract infection, some antibiotic, if there are lots of vomiting, dehydration, some fluid also. So that is actually the common symptoms of a type 1 diabetes. So even if somebody, some small child like 2 years or 3 years or 1 year old child also suddenly has a more increased frequency of urination, not eating properly, feeling very thirsty, feeling less energetic, keeping very low or a quiet, should be suspecting diabetes. uh, Unlike this, type 2 diabetes, just like type 2 diabetic in adult, many of the times are not having any symptoms. During routine checkup, because the child is significantly overweight, obese, they have some increased frequency of urination or recurrent urinary tract infections or some other infection, but they are not that acutely ill that within 7-10 days the child has suddenly become sick. So they are more or less very slowly progressive and less symptomatic. But most of the time, 95% of the children or 98% of the children below age of 12 years, definitely they are type 1. 12 to 18, I think 95% are type 1 diabetics, which are quite acute. Presentation is quite alarming for the patients or their relatives or their caretaker or their physicians or a pediatrician.
All right. So I think for our viewers, सबने सुने ये symptoms or early warning signs जो Dr. Parag which is shared with us. Look out for these things in case you have forgotten some of them. You can just simply rewind this program and see it again. This will remain here in this link. But the important point is that if you find these symptoms, don't ignore. Immediately go and talk to your doctor, and the child may need some help here. So now, once the child has come to you, you have diagnosed. Is it the same way you diagnose as you diagnose an adult patient for diabetes? And what about the treatment approaches? Are they same like an adult diabetic patient, or it is different treatment approach in children?
See, as soon as somebody is detected as a diabetes and somebody has acute symptoms, as I mentioned, most of the time we are dealing with a type 1 diabetes, which is autoimmune in nature. So we can find out autoimmunity by asking with the blood test like a GAD antibody or the ICA antibodies or insulin antibodies. And most importantly, it is just to diagnose the etiology. But most important is to measure the serum acetone values and any other precipitating infections or some other cause we try to find out. And we see the hydration status, whether child is dehydrated, then naturally, if the patient has acetone, nausea, vomiting, breathlessness, requires hospitalization with IV infusions and IV insulins. But most important aspect about the management is at the time of diagnosis is not just the medical aspect. I think the most important aspect is giving the mental support to the parents or the family members, and if the child is big enough, to the child. So sometimes it's very devastating. Not some of the time, most of the time it is very devastating. Why it has occurred to my child, whether it is curable or not, whether the child will need insulin lifelong or not, what is the future of my child. So we need, apart from the medical aspect, initially always we try to reassure the parents that with the modern medical therapy, your child can live a normal life without any complications. So, and because it is not that common as a type 2 diabetic, they have not seen anybody with a type 1 diabetes in their surroundings or their family members or among their social circle. So they feel that why only my child. So I always tell, I got a more than 10,000 children who are living with a type 1 diabetes. Many of them have married, many of them have got kids, many of them are having a good professional career in their life. And we give some examples, some sports person or some other people with a type 1 diabetes living absolutely a normal life. So we first give them, it's not end of the life for them. and your child is not different from other children. Sometimes you feel that child is either overprotected by the parents, that my child is different, so he cannot go to the picnic. Many times after the diagnosis, the child is on treatment. School has arranged a picnic for a day. No, no, my child will not come because he is suffering from diabetes. My child will not go to the birthday party because he or she is suffering from diabetes. So that is a huge psychological trauma, not only for the parents, but even for the children. It's very that I am different from the others. So we make sure that you are like a normal child. You can do everything which a normal child do. When I was doing my endocrinology training at SGPGI Lucknow, we took around 15 children with a type 1 diabetes for mountaineering camp. The mountaineering camp was for the all the young teenager boys and girls arranged by some organizations. So we make sure that we took 15 children and no parents were allowed, and they could do all mountaineering activity just like a normal kids. That boosted their confidence. So they should not lose their confidence, because this competitive world, to have the mental stigma that I'm suffering from a disease which will come in my way or for my child's way, that their physical, social, mental well-being would be affected. So we always try to counsel them. And fortunately now, I don't know why, but after COVID, we are seeing lots of reversal of type 1 diabetes. We're not talking about the honeymoon in diabetes. I don't say that all, but small percentage of the people are post-COVID are off insulin therapy also for more than 3 4 years also now. So if you are taking good care of your diabetes from the beginning, we can hope for the reversal also. But at least if you are not going for the reversal, we can assure that they will not have the any diabetic related complication. Second thing, all prepubertal children who have not started their sexual development until 5 years of till the 5 years after the diagnosis of diabetes, type 1 diabetes, they don't have the retinal problem or a kidney problem. So sometimes very small kids, sometimes parents are so much obsessed with the so-called normal values. Like 2-year-old child, we see patients or parents or some doctors also advocating fasting sugar should be less than 100 and post meal should be less than 140, and child is developing lots of hypoglycemias leading to convulsions. So till 5 years of age, we want hypoglycemia to be prevented, because child is less likely to develop any micro or microvascular complication or a retinopathy or a kidney problem or a blindness. So they should not have a too many hypoglycemias, and they can have a normal life. So it's a sometimes there is a economical issues also, that they will not afford the too many injections or regular blood sugar monitoring. Now we got a lots of avenues, lots of NGOs, lots of pharma companies, lots of us are ready to support such children if they are having a issue of their finances to manage the child. So that is also now possible, that it's very expensive disease and too many insulins and too many times checking the blood sugar is quite expensive. Sometimes parents are earning hardly 10,000 rupees. They cannot afford 2,000, 3,000 rupees a month treatment for their child. So previously, these children used to go for the ketosis because they were not able to continue on insulin therapy on a regular basis. So now we are ready to help. We, as a medical profession, pharma industries, socially, we are all ready to help these kids and their parents to have the healthy and the good quality of life. But most important is the medical aspect. Second is to boost their confidence that they are not different from the other normal child. So it's very important that they don't lose their self confidence. If they lose their self confidence, medically you are doing wonders, but child is not able to compete with their peers when they are growing up and going for the college or the professional life.
Well, thank you, Dr. Parag Shah. On behalf of my viewers, I thank you for building the confidence so much among them. And I think it's very, very clear. Medicines, if you are looking for a medical treatment of type 1 diabetes and in children, it's all available. But even more than that, as you mentioned, that don't lose the confidence. You're not alone, and everything will fall in place, and everyone is there to take care of you, especially your doctors. And trust me, if you go and talk to your doctor, then probably he would be even more compassionate and considerate to a child with diabetes than anyone else. So don't lose your confidence and talk about it. But so you mentioned two things more, during your conversation, and one was that many such children may be, having the chances of having hypoglycemia, low blood sugar, which can lead to certain complications. And since many of them would be taking insulins as well, so I would like, sir, that if you can focus on two things, that how they should safely monitor themselves, especially when they are in their adolescent age. What are the best ways to do proper monitoring? And secondly, how they should be careful about low blood sugar, and what are the remedies for that?
See, first and foremost, anybody who has a chance of development of hypoglycemia, whether it's a type 1 or a type 2, should be knowing what are the reasons the person can develop hypoglycemia. First, by accident, you have injected insulin more than what we are supposed to inject. Sometimes we have seen the patient is a different insulin at different times of the day. By mistake, they've taken the morning insulin at night time or vice versa. So at least make sure that you are taking a proper insulin and a proper dose at a proper time. Second, if child is sick and not able to eat properly, the chances of getting hypoglycemia will be more. But here I will like to warn, because we see most of the patients who ultimately, after diagnosis, if they develop diabetic ketosis or ketoacidosis, where patient requires hospitalization, is because the child is sick, child does not feel like eating. So parents are afraid about low sugar and they stop the insulin, thinking के child ने कुछ खाया नहीं है, इंसुलिन दे देंगे तो शुगर कम हो जाएगा. नेचुरली खाना नहीं खाओगे या कम खाओगे और इंसुलिन उतना ही लोगे तो शुगर कम हो जाएगा. तो इंसुलिन स्किप करते हैं. जैसे इंसुलिन स्किप होता है, इफ यू स्किप insulin 1 or 2 times, the acetone starts building up in your body, and because of the acetone in the body, you feel or child feels nausea, loss of appetite, and child again is not able to eat. So then again, parents would feel that okay, child has not eaten anything since morning, that means stop the insulin. So again acetone will build up, and again it will lead to nausea, vomiting. So that is what we call the sick day rule. So whenever child is sick, with the child is having a fever, nausea, vomiting, diarrhea, best thing is to monitor more frequently. If the sugar is, say, not very high, like say 150, 110, 120, 150, 180, 200, up to 200, you and child is not feel like eating or child is having a severe nausea, vomiting, whatever dose is due, you give the dose but reduce by 20 to 25%. If the sugar is above 250 and child is sick, you decrease the insulin not by more than 10%. If the sugar is above 300 and child does not feel like eating, give the same dose, because any illness or a stress would increase the hormones in the body, which we call the stress hormones, which will tend to increase the sugar. And at that time, body, if you are giving the less amount of insulin, child will develop acetone and child will have the ketosis, when which will require hospitalization. So they should understand the sick day rule. Any child who is having any medical illness should monitor sugar more frequently, and they should, they can decrease the dose of insulin if the medical help is not nearby. I always have a open access to me and my team. All type 1 diabetes can contact us anytime, 24/7, if they have any doubts. We are available on WhatsApp, we are available on phone call. But suppose it's not there, at least don't miss the or skip the dose of the insulin completely. You monitor the sugar, give less dose, 25%, 30%. At least body needs some insulin to prevent the development of acidosis. About the hypoglycemia, second is the unaccustomed exercise. Suppose child says that, parent says that okay, tomorrow my child is having a cricket match or a football match, is going to run around a lot. So we ask them that okay, you decrease the dose of insulin, and before unaccustomed exercise, have some food, carbohydrate rich food, which will take depending upon how long the duration of the exercise or a physical activity would be. carbohydrate or carbohydrate with protein rich food before they start the exercise. Check the sugar before exercise. And third cause of hypoglycemia is sometimes unknown. Because of the some unknown reasons, child can develop hypoglycemia. So if the child is developing unexplained hypoglycemia repeatedly, then we have to adjust, or the doctor has to adjust either the insulin dosage or the type of the insulins patients are taking. Because many insulins, the chances of hypoglycemia is high. Many insulin, the chances of hypoglycemia are less. So depending upon the reason of hypoglycemia, we try to adjust the dose or change the type of insulin patient is having. So this is the about the hypoglycemia. Now the symptoms of hypoglycemia in a children of type 1 diabetes, usually there is a perspiration, increase hunger, child becomes irritable, or sometimes child becomes very quiet, or occasionally they can, if the child is very small, specifically less than 3 to 4 years of age, child can develop convulsions or unconsciousness, because the brain is the only organ which continuously requires glucose or a sugar. So if there is a sudden drop of the blood sugar, there will be no enough glucose into the brain and child can develop convulsions. So they should know, they should monitor the sugar if possible. If it is not there, they should give 15 to 25 gram of the glucose. Many times we see that child develops hypoglycemia, they give them some sweets or a chocolate, because otherwise child is not allowed to have the sweets or a chocolate. So child also wants to have the chocolates or a sweets. So longer the duration of hypoglycemia, more will be the chances that body will also will try to correct it by producing lots of what we call the counter regulatory hormones or a stress hormones, and the sugar will jump, and people will feel that because we are given the glucose, sugar has gone up. So to correct the sugar within a short period of time, the best thing is to have the glucose. If it is not available, you can have the fruit juice or the sugary juice, not milk, not ice creams, because all these will take some time for the glucose to increase. And then after 10 minutes, child should have a normal snacks. If the there is a time of a snacks, or there is a time of a major meal, they can have their normal major meal.
Okay. All right. So I'm sure our viewers have made note of these things which Dr. Parag Shah has mentioned. Sir, as we are moving towards the conclusion of the program, I want to just take in one or two more questions, and one is very sensitive. Many a times, sir, when the child is diagnosed with diabetes, especially the girl child, a lot of parents, they tend to hide the situation. They don't want to inform the school management. However, a child is going to the school 6 7 hours in a day. What is your advice that how this whole thing should be approached? Should it be like hidden, or should an open discussion be done with the school teachers, principals as well, so that the
I
child
think
doesn't go into a problem?
I think I agree. It's more about the female type 1 diabetes kid compared to males. Still, we are unfortunately the male dominating community. People feel that if society knows that my daughter is having a type 1 diabetes, there will be some problem about the marriage. So they hide. I think at least their class teacher and the principal should be aware. Sorry. And one or two close friends of the child should be aware that they are having the type 1 diabetes, because the only major emergency which can occur and which can be easily manageable is the hypoglycemia. So the child should be having the glucose tablets or some sweets along with her in or her uh, lunchbox. School also should have some glucose candies or a glucose powder, so at least that part is cleared. So hiding something, we've seen a young girl getting married and spouse is not knowing that my wife is having a type 1 diabetes, and they have stopped insulin. And I remember couple of emergencies where they were on a honeymoon on a hill station, no medical helps were available, and it became fatal in one incident. So it's not something to be hide about. Fortunately, now gradually diabetes is becoming so common. People are ready to accept. And if I say that if somebody is not ready to accept it because of your diabetes, probably you are lucky. That person is probably not fit for you to have your life partner. In tomorrow something happens, what would happen to you after marriage if they're not ready to accept you with any disease? So I think hiding something is actually harming the child and to the future partners also on a long run. So it's better to wait even for the marital counseling, that you have the disclosure and you will get a better partner who is more understandable. I remember one young girl who got married and subsequently she had some gynec problem. The husband was so supportive that he told that we don't want a child, we don't want to go for IVF or we don't want to go for any treatment because we got one disease, type 1. Let us live together with type 1 diabetes. So now people are understanding. So don't hide fearing that future child or a girl will not be accepted into the society or into the marital prospects.
Yeah. So I think you hear Dr. Shah here, his advice to all the viewers in such a situation. So just one final question to you as we conclude and your concluding remarks on this. So now, let's say if a child has got diabetes, unfortunately in the adolescent age, but he has reached his doctor on a time, on right time. He's taking the right advice and in touch with the doctor. So can you tell us, our viewers, that would that child be able to have a long healthy life as like anyone, or would there be having multiple complications? And we just want final word from you on this to build our
See,
confidence.
fortunately, with the better insulin, better monitoring techniques available, better awareness available, I got around 10,000 type 1 diabetic children. Last 10 years, I hardly remember any child who has recently developed blindness or a kidney failure or any cardiac problem because of the diabetes. So the situation has changed. So it may look devastating. It looks that patients requires multiple insulin. There will be fluctuation of the blood sugars. But now with the medical knowledge improving, medical treatment being improved, lots of protective medications being available, I think child with a type 1 diabetes can expect a good, healthy, productive, and a fruitful life rest of their remaining years of their life.
Well, thank you so very much. And on this positive note and reassuring all the viewers with this confidence, I think it's time to conclude this program. I must thank here all our viewers who joined us live or who may be watching this program later on. See, the major objective about this program is to raise awareness about this topic, that you don't need to panic. You don't need to lose your confidence if the child is diagnosed with diabetes. It's all manageable. You just need to get the right counseling from your doctor and then follow the doctor's advice. And as Dr. Parag Shah told us, that if the doctor's advice is followed, if the medical treatment is followed, and if the child is having confidence, then life is full of flowers, and then you can lead a healthy and a long life. So that's the primary message which we want to communicate. And I must thank Dr. Parag with his level of expertise and experience. He agreed to come on and he has been answering some of the very, very basic questions which I've been putting for the benefit of my viewers. I must thank you, sir. If you want to,
I,
let's say,
I should thank actually the type 1 childrens are very close to my heart right from my endocrinology days. So anything for the children, I am always ready to help in all the aspects, whichever way I can. Thank you very much for inviting me actually.
thank you. Thank you so much, Dr. Parag, and thank you all our viewers. Will join us again soon for this program, and sir will invite you once again whenever we do a program in this regard.
Thank you.
Good
Thank you.
night, everyone,
Good night,
and take
everyone.
care.
Good night. Stay